I'm Dr. Elizabeth Geddes-Bruce, and today we're going to be talking about liposuction, the difference between SmartLipo and regular liposuction. The consultation process begins with the patient coming in for an examination, and at that point we go over the parts of their body that they may not like very much, that they'd like to improve, and what we can do, and go over realistic expectations and how we can get them the best results possible. We plan for the surgery that day and send some prescriptions, get lab work done, and then schedule their surgery. Then when they come in for their surgery, we give them a little bit of medicine to make them relax, and we start by first giving them the tumescent part of the tumescent liposuction, which is infiltrating very, very large amounts of a dilute anesthetic or numbing fluid that goes into the fat layer, and it basically plumps up the fat layer and it separates it from the important structures down below, and it makes it easier for us to remove the fat in a very controlled, even manner. That's the basics of regular liposuction. If we're doing the SmartLipo laser liposuction, we use a laser fiber that goes into the area as well. And first, before we remove the fat, it liquefies it, gently heats it, so that way there's less trauma and the fat comes out easier. Almost every healthy individual is a good candidate for liposuction if they have a decent amount of fat that we're able to really pinch and grab a hold of and make sure that if we remove it, they still have a healthy layer left. Obviously, if you're massively overweight or obese, then you really need to focus on your diet and exercise and save the liposuction for sort of fine-tuning those small areas that are more stubborn to weight loss. But if you have some questions, it's a good idea to just come in. We can evaluate you and tell you if you're a good candidate or not. Also, another thing that's important is your skin elasticity, because when you remove the fat, you want to make sure that the skin is able to recoil back and not be left sort of loose and hanging. And that's also something that your doctor would be able to discuss with you. So patients always want to discuss what their recovery will be like, and I tell them that it's a little bit different for everybody, but with SmartLipo laser liposuction, you generally recover much quicker than traditional liposuction. I've had patients come in the next day in high heels and a mini skirt walking around just fine, and I've had a few others that are still stuck in their pajamas and needing to take it slower. Most people are about ready to be back to normal at about a week. I think that's about right, and can get back to their regular diet and exercise routine, which we always highly encourage that you continue to eat well and exercise, sleep well as you're recovering throughout the process. That's how you will get the best results with liposuction, and we really strongly encourage it.